Hello and welcome to a special interview for The Wire. With India firmly caught in the relentless grip of Covid-19, there's one issue that is absolutely beyond doubt. Far more people have died than the government is prepared to admit. So today we ask, do we have an accurate way of calculating how many may have already died? And secondly, do we have a reasonably accurate way of estimating how many more could die before the present surge subsides? Those are two key issues I shall put today to someone who's been studying India's epidemic right from the very start of the pandemic, a senior lecturer at Middlesex University in London, Murad Banerjee. Dr. Banerjee, let's start with the death count. As of today, May the 8th, the official death toll is just over 238,000. But absolutely no one, either in India or abroad, believes that is the correct figure. We're all convinced it's a gross underestimate, and you only have to look at the evidence from graveyards, cemeteries, obituaries to actually see why people believe the death toll is much, much higher. So let me start by asking you, do you have any sense of the scale of underreporting? And secondly, is there a way of arriving at a more reasonably accurate figure for the death toll up till now?
I think those are very difficult questions. So it's very hard to be precise about the scale of the underreporting. The best we can try to do is we can try to estimate what it might be. And there are quite a few different ways that we can do this. And I'll start with the estimates that people have come up with, myself included. So estimates that I've seen have ranged between the true number of deaths being something like double the reported number, so 2 times the reported number, up to around 8 times the reported number. Those are the credible estimates that I myself have made and I've seen coming from other people. Now, where the truth lies, that's a very large range. Where the truth lies in that range, I think is something we can't know for sure. For one thing, I think it's a very variable picture across the country. You have some parts of the country where you have very high levels of underreporting of deaths. There are other parts where perhaps the official numbers are closer to the reality. And how that fits together is rather difficult to say a priori, although I think we do have ways that potentially we could try to answer this question. Would you like me to go into some of those?
Absolutely. You sent me an article you did just a couple of days ago for Open Forum, where you estimate 2 or 3 different ranges of underreporting, and the lowest of those ranges suggests that 80% of deaths are actually missing. And that would mean that the total death toll is not 238,000, but pretty close to 760,000. And that is the lowest of the 2 estimates in your article.
Yes, so the article was for the India Forum, and the lowest estimates was that there are 3 times as many deaths, not 5 times. 5 times was a kind of medium estimate, but lowest was 3 times. So that's my belief based on a number of different kinds of calculations, that the most optimistic scenario is that roughly 3 times as many deaths have occurred from COVID as have been reported. And those estimates are based on looking both at international data and looking at India's data. So you can try to work out, based on international data, on what death rates are in different age groups, what India's death rate might be. And you can also try to do the same thing, roughly speaking, by looking at data from parts of India where you have more credible data. So for example, Mumbai is a case which I've looked at where you have higher quality data. You can take that and try to use Mumbai's data to estimate what might have happened nationally. I think there are other ways of doing it. You can try to take case studies where you have good data, for example, from particular small regions of the country, maybe sometimes just from one village, maybe sometimes from a town over a period of time, and try to make the estimate about what the true death rate might be. And of course, the difficulty is, can you extrapolate those kind of estimates nationally? Maybe we can come back to that, but if you are able to...
I don't want to get lost in the detail of how the extrapolation and the calculation is done, because that may be beyond the attention span of the audience. Let me instead ask you, which of the 3 estimates do you personally put your finger and mark to? Is it the 80% deaths missing, which is the middle range? Is it the 66% deaths missing, which is the extrapolation based upon what happened in Mumbai? Or is it the higher one, which suggests that perhaps as many as 10 lakh deaths have happened? Which of the three ranges do you put your finger on?
So even the one from Mumbai, by the way, the 66% missing is a minimum estimate from Mumbai. Mumbai's median estimate is that about 80% of deaths in the country have been missed. I would say for myself, that would be my median estimate at the moment. I would say that for every death which has occurred, for every 5 deaths which have occurred, only 1 has been counted. Now, I know that sounds shocking, but that is actually my median estimate for what has happened in the country to date.
So let me just sum that up. You're saying you personally believe that for every death counted, 5 have been missed. In other words, the median estimate that 80% of deaths have been missed is what you go by. And you calculated in that article, and forgive me, it was for India Forum, not Open Forum, that this would mean the total death toll up till now would not be 238,000, which is the official figure as of this morning, the 8th of May, but pretty close to 760,000, 7.6 lakh.
No, it would be higher than that by now, because the calculations which I was doing in the India Forum were just for 2020. So at that stage, there were 1.5 lakh deaths, roughly speaking, by the end of the year. And so if you took 5 times that, you're correct, it would be 7.5 lakhs. But if you were to take today's figures of 2.3 lakh and multiply that by 5, you get something which is well over 1 crore.
In other words, you believe that already, as of the 8th of May, 2021, over 1 crore people have died.
Sorry, rewind, over 1 million. Sorry, not over 1 crore.
Over 1 million have died.
Over 1 million, yes.
Okay, this is an astonishing figure, but I'm simply underlining it, that the actual death toll you believe is over 1 million, over 10 lakhs. Let's at this point look at how deaths are likely to rise hereafter. And I'll break that into 2 questions. First of all, Jamie Malik, writing in the Hindustan Times, says that the present case fatality rate is 1.7%, and cases are increasing at just over 400,000 a day. And he calculates that this means that in 2 weeks' time from today, the daily death rate, which is just about 4,000 deaths a day, will actually jump in 2 weeks to 6,800 a day. Would you agree with that calculation?
So I don't know the exact basis of that calculation, but let me explain what I think are the 2 ingredients in that. So one is that, yes, deaths follow cases. So there's a time lag between when cases occur and when you expect to see a surge in deaths as a consequence of those cases. And the second, I think, ingredient in those kind of estimates is that as things have got bad, a smaller and smaller number of infections are being detected. So case detection is getting worse. So in fact, what's happening with infections is likely worse than what we are seeing happening with cases, because testing is not able to keep up. It's not able to capture the same fraction of infections as it was before. And whether we see that translate into a particular number of daily deaths, 6,000 plus daily deaths, is a matter of where that's happening. It's a matter of how good the death recording is, of course, in the places it's happening. If it's happening in cities, for example, we might expect.
Can I stop you there? Can I stop you there? Because what you're drawing question marks around is not the case fatality rate of 1.7%, but the actual number of cases, which at the moment are officially said to be just over 400,000. You believe, because testing is poor, the actual daily case rate could be considerably more than 400,000. And that would mean that the daily death rate 2 weeks from now could also be more than Jamie Malik's conclusion of 6,800. It could be past 7,000 or even higher, depending upon what the daily case rate is.
Well, the thing is that nobody doubts that infections are many, many times higher than cases. This has always been the case. This is true everywhere. It's true internationally. It's true in India. Most infections don't get detected. The question is whether it's getting worse. So whether at the moment we're actually detecting a smaller and smaller fraction of the total infections which are occurring.
What's your answer to that? What's your answer to that?
My answer is that very probably yes, because as test positivity goes up, so as the number of tests, so whenever you do 10 tests, how many of these come back positive? As that number goes up, then the chances are that we're missing more and more infections. So the detection of infections is getting worse and worse. And as that happens, you're not really tracking a constant percentage of infections with your cases.
Absolutely. And therefore, the conclusion I drew earlier, in a sense, gets underlined. Jamie Malek's extrapolation that in 2 weeks' time, we could end up with 6,800 deaths a day, actually, maybe on the underside, it may be many more because the case detection is becoming poor. Let me go one step further and try and see if we can estimate what will be the total number of deaths, not daily deaths, but the total number of deaths when this present surge subsides. Now, early estimates done by the Indian Institute of Science in Bangalore forecast that by June we would have a total of 404,000 deaths. IHME in Washington, in Seattle, predicted that by the end of July, India would have 1,018,000 deaths. But I noticed that IHME has done a new analysis just 2 days ago, and now they forecast that in September, India will have 1.4 million deaths. That's such an astonishing figure. I'm just going to repeat it, that by September, according to the latest IHME forecast, we will have 1.4 million deaths, at which point India's total deaths will be almost 500,000 more than whatever is the total for the United States of America at that time. As someone who follows this sort of thing very carefully, how do you respond to these estimates of what will be the death situation 2-3 months down the road?
Well, I think, first of all, we're not comparing like with like there, because I think the IISc estimate is for recorded deaths. I think the IHME estimate is for all deaths, including unrecorded deaths. So I think we have to stick to, are we estimating how many deaths will have been recorded in a couple of months' time, or are we trying to estimate how many deaths will have actually occurred? So I don't think it's past the bounds of credibility that in a couple of months' time, we will see 400,000 deaths recorded. So that's official figures, nothing to do with undercounting, just official figures. But that is based on the speed at which infection is spreading, looking at how fast, how many new infections are occurring every day at the moment, possibly, and looking at how many of those are likely to result in recorded deaths. I think the other estimates that you're presenting from the IHME are taking undercounting into account. So I don't think they would project that you will have over 1 million recorded deaths. I think they're projecting that you would have over 1 million actual occurred deaths.
But then, isn't there an interesting discrepancy between what you believe are the total deaths, including unrecorded deaths as of today, and what the IHME believes are total deaths, including unrecorded deaths in September, which is still 4 months away? You believe the total deaths today is 1 million. That includes unrecorded deaths. The IHME is saying the figure in September will be 1.4. So it's not a great increase that's happening according to this range, is it?
No, the IHME has released this calculation a couple of days ago. It believes that there are 3 times as many deaths which have actually occurred as recorded in India. That's their estimate for additional deaths, not 5 times, but 3 times. They may be correct. That's within the bounds of credibility. And it's on the basis of that I believe that these forecasts are being done.
Absolutely. And just to clarify for the audience, your figure that the total deaths, including unrecorded deaths, is 1 million today is on the assumption that, in fact, unrecorded deaths are 5 times more than the recorded ones. The IHME figure for what will be the situation in September is based on an assumption that unrecorded deaths are only 3 times greater than recorded deaths, which means...
As I understand it, that's the case.
Which means that, in fact, you could more or less combine the Indian Institute of Science figure and the IHME figure. because the Indian Institute of Science of 400,000 official deaths in June would be 3 times greater and maybe a bit more by September. So IHME would have to go up a little bit more, close perhaps to 2 million.
Yes, I should say that the IHME estimates are not transparent to me. So I do not fully understand the basis on which the estimates for India have been done, because I'm not clear what data has actually been used, what Indian data has been used in those estimates. That I'm not saying that they're wrong, but I'm just saying that they're not transparent.
Absolutely. And because this has been very technical, and because we've sort of toed and froed between different estimates and the different basis on which those estimates have been done, let me very quickly sum up for the audience what we've established before I move on. We've established that you believe, as of today, unrecorded deaths are 5 times more than recorded deaths, and because recorded deaths are 238,000 as of the 8th of May, that means the total death toll, including the unrecorded one, would be roughly 1 million. Secondly, the Indian Institute of Science in Bangalore has estimated that official recorded deaths in June will be just over 400,000. And you think that is well within the realms of possibility. It doesn't look outlandish to you. IHME, which calculates both recorded and unrecorded deaths, but believes unrecorded deaths are 3 times greater, not 5 times greater, their estimate, which, as you said, is not completely transparent because you don't know the basis on which they've done their calculation, but their estimate is that in September, the total of recorded and unrecorded deaths will be 1.4 million. Let's leave that there. I want to now come to another critical question, which is to try and understand why India's COVID death count is so poor. Now, the Indian government claims that 86% of all deaths are registered, but only 22% actually have a doctor's medical certification. And that varies pretty hugely state to state. For instance, registration in UP is just 61%. In Bihar, it's even lower at 35%. Medical certification in UP is just 5%. In Bihar, it's only 2.4%. And UP and Bihar are the 2 most populous states in the country. Doesn't that mean, Dr. Banerjee, that in the 2 most populous states, over 90% of deaths do not have any medical certification, and therefore there could be a lot of COVID deaths in those 2 states that we simply don't know about? That is one reason why India's COVID reporting is so poor.
Yes, I don't think one can draw a very direct line between death registration, certification of deaths, and COVID reporting, because the mechanisms and systems are different. But I think there's very likely to be an association between the 2. So what I mean by that is you have to ask, why is it that in some states death registration is low? Why is it that medical certification of deaths is even lower? It's presumably because people don't regularly have access to doctors, to hospitals when they fall ill. And equally, it's very likely that in those situations, in those contexts, people don't have access to testing as well. We can't say this for certain, but a number of case studies from rural areas of India, COVID-related case studies, suggest that you have a lot of people who fall ill and who do not get tested, and the opportunities for their death to actually be recorded if they sadly die, for their death to be recorded as an official COVID death are minimal. So it becomes very unlikely in some contexts.
And the extent to which these 2 factors are responsible for India's very poor COVID death count, the situation will get, I imagine, considerably worse as the disease spreads into rural India and semi-urban India. And by the way, that is where it's spreading as we talk. There are more and more cases happening in rural and semi-urban India where access to doctors, access to hospitals is minimal. And therefore, COVID deaths will be even more substantially underreported from these areas.
Yes, and I think we have news reports. I think there's some excellent reporting going on. And what that's suggesting at the moment is that this is happening. I mean, there are reports in the Hindi press of what's happening in villages in UP at the moment, what's happening in villages in MP at the moment. And those reports are suggesting that this is happening. You've got quite small villages with very, very high death tolls. I was reading one yesterday a village in UP where, according to the 2011 census, there are just 1,000 residents. And in 2 weeks, there were 15 deaths. And I don't know, it didn't say how many of those got recorded as COVID deaths, but another report on a village in Madhya Pradesh said that a village of about 7,000, there were 28 deaths in the span of 1 month. That was the headline figure. Many of them suspicious, as in with COVID-like symptoms, and only 3 of those got actually recorded as COVID deaths. So a huge tragedy, I believe, is unfolding in rural India, in parts of rural India, and largely unrecorded.
For the benefit of the audience who don't read Hindi papers, there is a very similar article, in fact, a very large article in yesterday's, the 7th of May's Hindustan Times, which gives in great detail how the virus and disease has spread to UP. The deaths are going up, but the official number that are actually attributed to COVID remains suspiciously and worryingly low. So the Hindustan Times also has a very large spread yesterday on the same subject. The third reason, in a sense, is the most surprising reason, and that's because deaths that we either have good reason to believe are COVID deaths or good reason to suspect are COVID deaths are not being reported. Newspapers have already shown how the official policy in Gujarat is even if someone dies after a COVID positive test, but they have a comorbidity, the death is ascribed to the comorbidity and not to COVID. And that clearly will officially reduce the COVID tally, but very likely wrongly reduce it. And then, of course, there are those people who die of COVID at home or die in non-COVID hospitals or die without having had a test, but are clearly showing symptoms of COVID. And again, none of those show up as COVID deaths. And in a sense, possibly this third category may be the biggest explanation for why COVID reporting of death is so poor in India.
Yes, absolutely. And you've really hit the nail on the head with those two things. One, this business of attributing deaths to comorbidities, even when the patient has confirmed COVID. This problem was actually set up quite early last year. It was being done very widely, like you mentioned, Gujarat. It was widely reported last year. There was no action taken against Gujarat for this, even though it's in violation of the Indian Council of Medical Research's guidelines. So ICMR guidelines say that those deaths must be reported carefully, that you have to do a careful audit, but in most cases, those deaths are going to be reported as COVID deaths. And I believe that Gujarat was kind of clearly violating those guidelines, but no action was taken. Gujarat was not alone. These reports came out from several states, and only in a very early case in West Bengal was some action taken on this. And in a sense, that was the time when the central government did the right thing. It said, you have to reconcile your debts. You have to correctly count these debts as COVID debts. And after that, there were no more reports of that. So there's this issue of comorbidities. And then I think the second issue you touched on is the other crucial one, which is where you don't have a confirmed COVID death. It hasn't necessarily occurred with a test report to say that this patient had COVID, but all the signs and symptoms are that it was a COVID death. And that's a suspected COVID death. And again, I think the guidelines, WHO guidelines included, are quite clear that you need to record suspected COVID deaths as COVID deaths. Perhaps afterwards, you can ask the question of how many of them were actually COVID deaths. But in the interim period, you need to record them as COVID deaths so you understand what the pandemic is doing.
Now, in England, and I'm sure this is true of most of Europe as well, they have a system whereby they can more accurately assess the quantum of COVID deaths by measuring what they call excess deaths. Is it possible in India to measure the quantum of COVID deaths by the excess death route? Or because we don't have proper medical certification of death, is it very hard to do it in India?
Well, I think it's possible. I think it's possible by different mechanisms to actually record excess deaths in India. So although death registration is not complete everywhere, there are several states where it's pretty close to complete. It's effectively 100%. So let's leave aside the question of medical certification. This is just about death registration. At least in those states, if the data was regularly shared for how many people are dying. So the trouble is not that the data is not being recorded, it's that the data is not being shared. That's the reason why we don't know what's happening in terms of excess deaths in those states. Now, in parts of the country, in some states, in some rural areas where death registration is more limited, I think you have other means by which you can try to fill that gap. you can try to do surveying. You can go literally door to door, or at least a sample of the population, and ask, has there been a death in the family? What were the kind of circumstances of this death? So you can get a credible estimate for what excess mortality looked like during the COVID pandemic. And there are people much more expert than me who have given very practical and specific suggestions for how this could be done to get a kind of estimate for the true toll of the pandemic in terms of excess deaths.
You've shown us how it can be done very quickly. Is there anyone who's done it?
Within India?
Yes.
Well, not systematically. I mean, some cities and some regions have released all-cause mortality data. For example, Mumbai has all-cause mortality data from 2020, but that's a kind of full year's worth of data in one. Really, what you would like is month by month, or even better, week by week, so you can track how it corresponds to the actual epidemic, how it was being affected by COVID as COVID was spreading. Kerala has released some all-cause mortality data, again, for the whole year. Again, you would like it to be more detailed and specific. So it has been done in a few isolated instances. There are probably a few other places which have released some data, but it's too limited.
And therefore, we don't have sufficient nationwide data to carry out an excess death analysis that leads you to some outcome of what is the total number of COVID deaths. Nationwide, it's hard to do. You might be able to do it limitedly for Maharashtra or Kerala.
Well, I think we will eventually have nationwide data, because I think there are...
Eventually, of course, but as of today, we don't have it.
We don't have it, no.
We're coming to the end of this interview, Dr. Banerjee. Let me ask you this. Is there any sense of pattern or similarity in the way deaths are happening across the country? Or are there fairly substantial, intriguing disparities region by region?
Well, when it comes to recorded deaths, there are huge disparities. There are huge disparities between states. There are huge disparities between urban and rural areas, as far as we can tell. And what I mean is, we see some states where serosurveys are telling us infection spread very widely, and yet the state has reported relatively few deaths. We see this if you look district-wise, you see this in some rural districts, for example, that actually last year they reported a high level of infection, but very few deaths. Whenever we see those disparities, I think the first question we should ask is this a genuine fact that few people died? They were somehow protected from effects of severe COVID, or is this about poor death surveillance in those areas? But we see huge disparities.
And your hunch, I suspect, is that it's poor death surveillance.
Yes.
Tell me something else. There are many people who say that at this moment of crisis, concentrating on deaths is the wrong thing to do. Trying to correctly estimate either how many have already died or how many more will die before the surge subsides is wrong, a waste of time, it's irrelevant. How do you respond to that viewpoint?
I think it's an incorrect view for a number of reasons. I think there are questions of justice and accountability, first of all. So leave aside questions of epidemiology and understanding the epidemic. There are questions of which communities have been very badly affected, what can be done to compensate, to somehow mitigate against what has happened within these communities. And we need to understand deaths to understand that. We also need to break the narrative that, okay, India's mortality is low, there's been successful handling of the pandemic, because I feel that that narrative is really what led to the complacency which came before the second wave. It was a narrative which was founded on incorrect data, on limited data. So we have that question of accountability. Will somebody take responsibility for the true scale of the devastation? And then, of course, we also have the epidemiological kind of arguments, which say that how can you actually track, forecast, plan what's going to happen next, plan vaccination, if you have extremely poor data, you don't know how the epidemic spread, who was affected.
Absolutely. And in that answer was a very important point you made. India got a lot of satisfaction and reassurance, particularly during the first wave last year, when we kept repeatedly saying our deaths per million are very low. Incidentally, they're only very low compared to the West. Compared to our neighbors, including Pakistan, Sri Lanka, Afghanistan, Bangladesh, they're actually higher. But leave that aside. That low death per million gave us huge reassurance last year. But in fact, if you are not correctly reporting deaths, and many of them are being deliberately shown to be non-COVID deaths, even though the person died after a COVID positive test, then in fact the assurance you take from that low figure is only a case of fooling yourself. The figure is wrong, it's misleading, it's untruthful, and any assurance it gives you is leading you into a fool's paradise. And that's another very important point you make, and that's why accurately calculating the numbers that have already died as well as accurately estimating those that will die is important, because it keeps you rooted to the ground and it protects you from misleading false reassurance that we have a very low death rate. My last question, I'm going to go back to that very latest survey or forecast done by IHME, and I'm quoting from them. They say, given our expectation of continued deaths, COVID is going to rival Spanish flu at the global level in terms of the death count. And they add that they're only talking about deaths directly attributable to COVID, not deaths because the health system has collapsed. Do you believe COVID will rival the Spanish flu? If I've got my head on right, I believe something like 50 million people died during the Spanish flu.
Yes, I believe somewhere between 20 and 50 is the kind of the estimates for how many people died. I honestly believe that COVID shouldn't rival the Spanish flu with those kind of death tolls. We have vaccines, we have vastly better healthcare, we have vastly more knowledge and understanding of epidemiology. So I don't want to comment on whether it'll happen, but if it does happen, it is a huge global failure, because there is absolutely no reason why the death toll from COVID should ever reach the heights of the Spanish flu death toll.
My last question, what steps should the government take to ensure that we have better reporting of death? And more importantly, to ensure when there is, I'm not even saying if, when there is another pandemic, we are more able to accurately estimate how many are dying. What critical steps should they take? But briefly.
Well, briefly, I feel that the process of data collection and recording needs to be taken out of direct political control, because it's too complicated. If the systems by which, deaths are collected, that data is collected and recorded are under too much political influence, the temptation to interfere with that data is too great, to delay its release is too great. So you need to have independent bodies which are collecting, scrutinizing, and releasing the data, which are really released from political control. I think some of the detail of it we've already talked about death registration. Obviously, you would like it to be more complete, but where it is not complete, you need to do surveying. This needs to be done routinely. It is being done, but that data needs to be released routinely, needs to be shared publicly.
Thank you very much indeed, Dr. Banerjee. I thank you for giving us what you believe is the best estimate of the total number of deaths so far. And you say that's about 1 million, roughly 5 times more than the official toll of 238,000.
Yes.
Take care, stay safe.
Thank you.